This is Fein. I am going to be talking about When Flora Goes Bad, which is my MBA capstone project from 2007. So When Flora Goes Bad is an infection control education program for school children. It's designed around a fictional entity called University Hospital, and the whole idea is to create a program that could be implemented at a community health organization and see benefit in the community. So that was the central assignment for this capstone, and I will now walk you through it. We start with the mission statement, which is to bring information to the community that improves wellness and instills health in the decisions that community members make. This is very important because the mission statement lets people know what the goal is of the organization as it relates to being in the community and how the community would see them. The vision statement is related to the corporate values or organizational values and how an organization or program views itself. And so for this organizational program, we see ourselves as guides and partners in the healthcare needs of our community members. We want to be able to ensure that our community is healthy. It's very important that the community be healthy, especially now. In 2007, when I put this together, it was important, but it's become even more important because of all of the penalties hospitals can get if they have high infection rates among their patients. So trends in utilization patterns. In this particular case, this hospital has seen an increase of patients with infections. This education program will help reduce that trend so that personnel can focus on other things. This will also help with the trend of children coming to the hospital. Most of this particular hospital's business is children. This is a fictional pediatric center for the most part. Focus on children is the best way to go in order to allow the staff to focus on other areas of healthcare. And this is because children tend to pick up germs, and many germs travel the fecal-oral route. So financial impacts related to this are hours of overtime that staff have to put in treating patients with infections, preventable situations which can create the hours of overtime, lawsuits, other issues, redundancy in staff, and of course other concerns that can come up. Some of those might be related to patients not returning or public relations, regulatory concerns. That's just a miscellaneous category. Funding will be from the hospital foundation and will not affect the current budget, and we'll be able to take care of some of these issues. So that was the way I chose to deal with this. Organizations, of course, have to look at however they can deal with it. But since I had free reign, I decided to make a foundation that was funding most of this. Staffing resources for this project would be nurses and other professionals at the hospital, as well as volunteers and other staff. Other staff would be non-clinicians, people who maybe are doing the data entry, or people like me who are doing data analysis as to how effective this program is. Additional impacts would be goodwill in the community, a chance for the hospital staff to be out in the community, and of course disease prevention. Technology impacts. Microscopic pictures can be used to show things. You can do digital presentations like I'm doing now, and of course email at the hospital. And that was back in 2007. I'm sure there's more technology impacts today. Some of the risks involved. Not all schools have nurses. I grew up in the state of New Jersey, and New Jersey does not require schools to have a nurse on staff, so that could be a problem. Resistance to change. Change is a problem for many people, and there is active and passive resistance to change. Access to the schools may be an issue. Principals might not want to let students participate in the program, or parents may have some concerns. There's all those sorts of issues. In fact, parental refusal is listed down there. Foundation review process is also a risk. It's not necessarily a bad thing, but the review process is kind of important to pay attention to. And of course, staff availability. There just might not be enough staff to go around for this project. So, countermeasures and risks. Not all schools have nurses. Put more nurses in schools and create alternative paths for school nurses. I believe some of this is already being done because there are now direct entry master level courses for nurses, and there's been a lot of work done in the area of nurse staffing. Resistance to change. Explain to people why change is good and demonstrate the benefits. This is the whole what's in it for me mentality. Access to the school. Run its course and we're doing the best we can, and checking with what the barriers are specifically to access to that school. Foundation review process. Explain to the staff the benefits, and that works also for staff availability. That works for both of these here. Parental refusal, again, explain the benefits. If your child isn't coming home sick, you're less likely to get sick. So communications need to be done with the school, with the hospital staff, with parents, with the hospital foundation and administrators, with community members in general, and other donors. It is very important that these communications be clear and be regular so that people can be updated and know what's going on. Why is this important? Well, infections are a very real threat to public health, and this has become a bigger deal since 2007. I'm not going to belabor the point, but infections are a problem that need to be addressed. Staff time can be used to serve the community and cut down on the hospital transmissions of infections, rather than going around and treating these infections. Also, this program would foster good habits in children, and it would foster goodwill in the community. And most importantly, this is an issue that's under-taught. A lot of people don't know that if you sneeze, those cold germs stay on whatever you've sneezed on, the chair or the table, for an hour after you leave. So it is very important that people be taught good hygiene. So measurable goals. Here's a sampling of goals. How many students can we reach? How many cases of infections are cut down at the hospital? How many schools are we in, and how satisfied are the participants? And these are all things that informaticians like myself can track. Implementation. What are the current trends and what's happening? That's always a good place to start. Phase it in over 3 years and have room for further expansion. And I think a 3-year phase-in is good. It gives you a pilot year, a year to tweak, and then a year that you can go full steam ahead with room for further expansion. How often have you washed your hands today? Hand washing is under-practiced. Proper technique seems to be lacking, and the significance of hand washing is underestimated. Hand washing is probably the biggest thing that someone can do to cut down on their risk of picking up an infection. But for some reason, the benefits of this are really underestimated. Education is key. If you know what the proper techniques are and how appropriate products should be used, the alcohol gels and all those other antibacterial soap and regular soap, and how often you need to do that depending on what your job is. Healthcare workers obviously have to do it quite a bit more. How often have you washed your hands today is a really important question to ask. In conclusion, this is a great program because it would save the hospital money in the end. It would save staff time. It promotes the hospital in the community, works within the constraints of the risks and countermeasures outlined, and it promotes lifetime habits. So I would like to thank you for taking the time to walk down memory lane and test out this audio again. And that is the end of our presentation.